person na moguda daga safsna ang excusinde. Madu Gurungay has asked the Asmunya doctor, I have this snoring problem and what might be its treatment? First, let's understand what snoring is. Snoring occurs when the muscles located around our windpipe during the time we are asleep enter a relaxed mode, meaning they become slack or flaccid. As a result of this, they press on our airway or partially impede the flow or create an obstruction. Subsequently, when we take a breath in and then breathe out, a distinct vibration is generated in that area. This particular condition is what we refer to as snoring.
Now, there can be many different reasons for this.
The first reason is related to the mouth, specifically when the tonsils located inside the mouth become enlarged. Similarly, another reason is the condition where the adenoid tissue has grown. Another factor is this muscle that hangs above the tongue, which is known as the uvula. That is an enlarged condition. Similarly, another is a nasal problem. In nasal problems, specifically in patients with DNS, which is called deviated nasal septum, a condition where the nasal septum is bent. Similarly, a condition of increased tissue inside the nose, which obstructs breathing and can cause snoring problems. This problem can also manifest congenitally right from birth. This condition is medically termed obstructive sleep apnea. Another significant cause is observed in individuals who consume an excessive amount of alcohol before going to sleep. This issue is also observed in some heart patients and also in individuals who are overweight. So how is its treatment done? Let's first identify the cause and then move towards management. If snoring is a problem, you should not sleep on your back. Try sleeping on your side, and you should slightly elevate your head. Similarly, avoid consuming excessive alcohol before going to bed. If the patient is overweight, then weight management needs to be addressed. If the patient's problem is a bit more complex, then medical tests such as polysomnography might be necessary. This specific test will need to be performed. This situation typically arises when the patient's condition or their problem is quite severe. When a patient is sleeping, they might suddenly wake up feeling startled or disturbed. They may experience a sensation of being pressed down, or sudden jerks might begin. In such situations, a polysomnography test is necessary. Additionally, sleep problems like difficulty falling asleep or conversely, excessive sleepiness can also manifest. A homeopathic treatment for these conditions is indeed possible. We aim to treat patients based on their symptoms, applying a homeopathic approach to their care. And in most cases, this has been successful. For some surgical cases, we have also referred them to surgeons, and this is our process.